Good evening, everyone. I'm Dr. Alkeen, specialist in Department of Obstetrics and Gynecology at Aster Hospital. Today, we are going live on Facebook, and the topic for today is myths and facts for nutrition during pregnancy. Pregnancy is a situation where the mother is constantly worried about the health of her baby, and to top it all, she is always being faced by a volley of information from her concerned people, friends, relatives, and she may be misguided on certain aspects. So today, to clear it all for us, we have with us Dr. Sapna Lulla, lead consultant in the Department of Obstetrics and Gynecology at Aster Hospital. Good evening, ma'am. Welcome to the live session.
Hi, Alkin.
Your opening comments, ma'am?
Nothing much. If I were to say to someone in the OPD that if at all you do not eat healthy in pregnancy, half the wrinkles come up on the face. They are very worried. They're like, is my baby going to be fine? Is my baby going to be low birth weight? What can I eat to improve on this situation? So to clear all these things, here we are, the team of OBG from Aster, to enlighten the facts on the nutrition in pregnancy.
Thank you so much, ma'am. So, ma'am, we'll go through the common questions that are commonly asked in OPDs. What is a balanced diet and its importance in pregnancy, and how should a pregnant woman balance her diet?
Okay. So we'll answer this question in two halves. A balanced diet in pregnancy is something which has an appropriate amount of carbohydrates, appropriate amount of proteins, appropriate amount of good fats, along with the vitamins, minerals and micronutrients, with good amount of fluids in it. Here we need to understand, when we say it is balanced not as a blanket, it is individualized to the patient concerned. It depends on your pre-pregnancy weight, what is the appropriate diet for you to have a balanced amount of the nutrition in it to supply the good amount of nutrients for a healthy baby. That is what a balanced diet means. Second question.
Ma'am, what is the recommended weight gain in pregnancy?
The recommended weight gain in pregnancy is highly individualized. Depending upon your pre-pregnancy weight, that is when we calculate the recommended weight gain for you, keeping the body mass index in mind. The BMI is calculated depending on your pre-pregnancy weight divided by your height square in meters. So, if your pre-pregnancy weight, the BMI shows that it is less than 19, then your weight gain is an average of 9 to 11 kilos. If at all your BMI is between 19 to 25.5, then the weight gain could vary anywhere between 11 to 17 kilos. If at all it is above 26, then there is a track monitoring by your clinician to identify what should be your sustained weight gain for you. So it is highly individualized and calculated according to the BMI.
So, ma'am, is it anything to worry if a woman does not gain weight in the first 3 months of pregnancy?
Definitely not. If you do not gain weight in the first 3 months of pregnancy, it does not necessarily mean that something is wrong in you. Very often you would have seen in the OPD, we always see the contrary. There is a loss in the first 3 months of pregnancy, and this could be because the hyperemesis or the vomiting and nausea which many a pregnant woman go through as result of her hormonal imbalance, because of the aversions of smell, the aversions of taste, the lethargy, the increased sleepiness which does not allow her to wake up, to cook for herself and to provide for her needs. And it also depends on your metabolism. All these influence the gain in weight. So definitely the first 3 months, when your body, which is a clean slate, is getting accustomed to the growing embryo inside you, you find the hormones playing the magic down there and not allowing you to actually gain weight in pregnancy.
Thank you, ma'am. That was one major concern which most patients have. So how should an obese pregnant woman balance her nutrition versus weight gain?
Again, as we just spoke, the weight gain depends on the BMI. So, when the BMI is calculated, for any patient who is on a higher BMI, she needs to initiate her conversation with her clinical care provider to start tracking her weight. Once you start tracking her weight, you identify the foods which are rich in the correct amount of calories, which are rich in proteins and increased fiber diet, more amount of micronutrients, so that the fats are not gained in excess. Usage of more amount of polyunsaturated fats in such patients can help her gain weight, which is only what is actually needed in her pregnancy, rather than becoming overweight in her pregnancy. So she needs to actually track down her weight and keep an account on the weighing scale, keep watching what is the weight gain which occurs. Usually it is better to monitor these weights at the same time of the day and preferably without major clothes worn, so that it can be done. So identify a weighing scale and buy it and keep it at home, so that it helps you to see what is your graph, is it going above the range or not, and that will help your clinical care provider to understand where to draw the red flag on it.
Right, ma'am. So what are the recommended supplements in pregnancy, ma'am?
Coming to the recommended supplements in pregnancy, more amount of folic acid is something which we all hear in pregnancy. It is a very common phenomenon. This is always heard in the reproductive period and in the childbearing period and during your pregnancy. As we all know, folic acid, otherwise known as folate, from the Latin word folium, it is mainly found in green leafy vegetables. The folic acid, if it is deficient, can cause neural tube defects in the babies. This is the most common side effect of folic acid deficiency we have seen. So what is the neural tube here? Just to enlighten on it, a neural tube is something which initially starts off as a flat and then rolls on to become a tube. If at all you are deficient in folic, the cells within this area do not function properly to form the tube and lead to deformities both in the spinal cord, skull, brain, impairing the cognitive function and impairing the psychomotor developments and the neurodevelopment and leading on to delayed milestones. So this is what shows us what is the importance of having your supplements in pregnancy. Again, one more reason to visit Aster, the obstetric clinic, for these pregnancies, so that your clinicians, over a rainbow of people who are present here, senior gynecologists, can identify, are you at risk of developing these? Do you need supplements? Do you need a counseling with our dietitian who can help you on to develop and see that these deficiencies are catered well enough with supplements to you? Again, we have the iron supplements and the calcium supplements also, which are provided over the counter. So it's all about making your visits, making your antenatal visits, so that these deficiencies are identified at the right time and corrected accordingly.
Thank you, ma'am. That was a very well explained guidance. So, ma'am, we come to the most common topic that women face across the world, especially in India. Anemia. So what are the deficiencies which cause anemia and how do we prevent them?
In pregnancy, we definitely know that the most common form of anemia is an iron deficiency anemia. When you're low in your iron reserves, which could be because every Indian woman usually concentrates on her health only in pregnancy. Otherwise, most of the time, she's busy taking care of family, taking care of children, attending on mothers, attending on as a good daughter, as a good wife, as a good mother to her children. But it is only the pregnancy time when she actually tries to concentrate, again because of her fetus. And this is when we realize that very often the iron stores are less and she's more prone to iron deficiency anemia. By identifying them and providing diet charts, dietary foods which are rich in iron resources, and providing the correct iron supplements, we can see to it that we can avert such situations in a pregnant woman.
Thank you, ma'am. So, ma'am, what is the recommended fluid intake in pregnancy?
As we all know, in pregnancy, the demand of fluids is much more as you would have at any other times of your life. Hydrating yourself in pregnancy is more imperative because the body surface area increases much more in pregnancy. Hydrating yourself is much more important because this helps the body in forming the amniotic fluid. It helps in the transportation of nutrients. It also helps in removing the waste from the body. It also helps in supplying appropriate amount of oxygen, removing the toxins from the body. In such situations, hydrating yourself well enough with liquids is very important in pregnancy. A good amount of 2 to 3 liters of fluids, which could include 8 to 12 glasses of water in a day, would be an appropriate amount of intake of fluids in pregnancy. This could include a variant of any kind of normal juices, soups, occasionally aerated drinks within limitations, occasionally a cup of coffee with a limited amount of caffeine in it. These things, along with buttermilk, can be a normal part of your fluids. Fruits which are rich in fluids, vegetables which can provide us with the amount of fluids, can also be a part of hydration on regular basis.
Thank you, ma'am. So, as you said, caffeine, ma'am. So, what is the restriction of alcohol and caffeine in pregnancy?
There is no standardized recommendation saying that this much amount of alcohol in pregnancy can be a safeguard to the potential damages which alcohol itself can cause to the developing fetus. Again, coming to caffeine, there is no recommended amount as such. But yes, definitely as per medical evidence we have seen, somebody who could be caffeine sensitive, just 100 milligrams per day should be sufficient. Somebody who's not caffeine sensitive, even they can go up to about abusing 300 milligrams of caffeine per day. So that would be like 2 cups of coffee per day. Again, the amount of caffeine in your coffee or tea makes a variation in it. If you are taking something like a black tea or a green tea, which has a minimal amount of caffeine in it, varying between 20 to 30 micrograms, then it is absolutely fair enough. But if you are taking the strong coffee day coffees, which we would think of, it would definitely have a big glass, something like I would say the normal coffee day glass, would provide you more than 150 milligrams of caffeine in it, and that could become a red alert onto you.
Right. What about smoking, ma'am? Smoking and its adverse effects.
I think we all know very well, smoking is a definite no in pregnancy because, as you know, it affects the oxygen carrying capacity. It also causes birth defects in babies, leading to cleft lip, leading to cleft anomalies. In addition to that, it can also affect the tissue damage. It can break down the tissue more easily. And in every trimester, it can cause a side effect. If I were to see the first trimester, it can lead on to effects like bleeding tendencies can be there. Residual reactions, implantation reactions can all get affected. We could have more chances of miscarriage. If I were to come into the second trimester, more amount of birth anomalies could be seen there. Cleft lip, cleft palate, as I had already mentioned. Low birth weight babies, early placental separations, placental leaks, again probabilities of threatened miscarriages, threatened preterm labors, and early preterm labors, premature rupture of membranes. Again, in the final trimester, we could have, in the third trimester, we could have preterm labors, low birth weight babies, even stillbirths at certain instances. So definitely keeping this, smoking would be an absolute no, both active and passive in pregnancy.
Thank you, ma'am. So, how safe is it to eat outside food or junk food?
That has become a part and parcel of our life now.
Very true.
Most of us, with our working schedules, expecting a pregnant mother to cook for herself and to manage everything is definitely very difficult enough. Occasionally eating outside, eating out of the boxed foods, eating out of a bagged foods, as long as the foods are clean and healthily prepared, should be fair enough. Having the appropriate servings there also should be fair enough. But if it is not cooked properly, if it's uncooked food, unpasteurized food, not well packed, not safely cooked, then definitely it is a no in pregnancy.
Thank you, ma'am. So nowadays vegan food is on the rise. So we want to know, is vegan diet safe in pregnancy?
Historically, vegans have always been criticized to be low both in the folic acid content, in the iron content, in the calcium content, and omega fatty acids. But again, eating vegan has become highly popular nowadays. Keeping that in mind, choosing the appropriate foods with the correct amount of folic acid in it and adding on a natural supplement along with it can definitely make a vegan diet a must in pregnancy. There is no harm in taking a vegan diet in pregnancy then.
Coming to the relaxation part, ma'am, what about rest and exercise in pregnancy?
Coming to the relaxation, as we all know, relaxation plays a major role in any part of our life. The endorphins, the metabolites, whatever are released in our body regulate both our emotional response and our physiological response. If we need to have a control both physically and mentally on our journey of pregnancy, then definitely relaxation is a must, which will help us to release the appropriate amount of endorphins, which will help us to keep a watch on what is actually needed. And to add on to this, rest can be a tip of that iceberg. So, resting well, many of them say, can provide appropriate oxygen levels to the baby, can help the baby to receive good nutrition because good blood supply goes to the placenta. But resting itself can reduce your stress levels, can reduce your adrenaline release, and help in good growth rate of the baby.
Thank you, ma'am. Now we'll address a few myths in pregnancies that are commonly asked, ma'am. So, is it true that a pregnant mother should eat for two?
That is an ordained judge. Every patient who comes to the clinic is often asking, should I eat for two? And when it is a twins, then it becomes, should I eat for four? Definitely not. Doubling your calorie intake is just going to make you gain the weight, which is going to be difficult to shed off afterwards. Eating healthy, eating the appropriate nutrients will give you the appropriate nutrition for the good growth of these babies. So here comes the dietitian department of Aster, where we provide a proper chart to the pregnant mothers at their very initial obstetric visit in our antenatal clinics, where we identify what is it that they cook at home and provide a chart according to their staple diet so that she does not have to spend more time in cooking, more cost effective it is, and it is more individualized to her. Here is where Aster Dietitian Department comes into the play as a part of our multidisciplinary approach.
Right, ma'am. Next question, ma'am. Should fish be avoided in pregnancy as many people believe it contains mercury?
Fish can give you a good amount of protein. At the same time, it does have certain amount of mercury in it. So here comes that we identify what are the fishes which can be taken and in what appropriate servings. 2 servings of fish in a week should be fairly good enough. Fish like tuna, fish like salmon, sardines should be fairly okay enough. The ocean-oriented fish could have high amount of mercury in it. The merkels, the sharks should need to be avoided. Crabs and oysters are also okay in pregnancy.
Right, ma'am. So, does eating papaya and pineapple cause miscarriage? The commonest myth in Indian household.
We do not need the medical termination act. No, we can use the papaya and we can use the pineapples to cause these abortions. Okay. As we all, jokes apart, as we all know, papaya is a controversial thing. The papain which is present in an unripe papaya and the papain which is present in a ripe papaya both have 2 different actions to perform. The papain in an unripe papaya can cause probabilities of miscarriages. It can cause early placental separations. The papain which is present in the ripened papaya can lead to good amount of vitamin A and vitamin C and help in increasing the luster to the skin. It can help in cell development and it can help in tissue development. As far as the pineapple is concerned, it I think is absolutely a myth, doesn't do anything. But yes, I would definitely say anything in excess can be abusive. So eating little in moderate quantities is not going to cause any issue. But having eaten something, this is something for you all that you do not have to get worried by taking one piece of papaya or pineapple that is it going to harm your baby or cause any kind of miscarriage threat to you.
Right, ma'am. So, any foods that can bring on labor or facilitate delivery?
then we clinicians wouldn't be required here.
We have patients coming in with grandmother giving them butter, ghee, and all possible things. So, ma'am, please clarify on this matter.
Okay. Coming to the scientific evidence, when we give an enema, it helps to evacuate the bowels and get the baby down. So again, your butter, your ghees, it helps in evacuating these bowels, and it helps in labor time to help the baby to align well with the pelvis, and the uterine contractions become more coordinated with it. That is what the ghees and the butters do. But the process of labor as such getting aggravated, certain herbal oils, certain castor oils can release some amount of chemicals which are similar to our prostaglandin release. But the evidence that these can actually make a cervix efface, could make a cervix dilate and take you into the labor process as such, definitely no. Labor itself, as you know now, can be as natural as possible. Nature takes its toll when it realizes the fruit is ripe. At 40 weeks, we have nature's own natural process happening, which is allowing a more amount of natural births at this point of time, where we have many a patient waiting on such things. So at that time, whatever inputs could be a castor oil, could be a papaya, could be a ghee, could be could be a butter, they all feel can induce labor for them. They can only release certain chemicals which can cause some actions which are very similar to the prostaglandins, but actual evidence of inducing labor with all these is not really proven.
Thank you, ma'am. So, last question, ma'am. Foods to improve lactation post-delivery.
This is something very often we see in the OPD, right?
Yes.
They always feel my stream of milk is not good. My breasts don't feel heavy. My baby is always crying. Do I have the sufficient milk or not? Whatever amount of evidence we give them that this is sufficient, your baby is active, your baby is feeding well, then also they are half worried about it. Yes, we do have certain foods which mimic the same evidence as galactologs. Could be certain amount of seeds, could be certain amount of methi, which is a very common thing. Cheese, could be your, cheese, methi, fenugreek seeds, sesame seeds, and breads. These are all known to cause some amount of increase in milk secretions. But the more amount of milk secretion comes when you do an exclusive demand feeding. When you are relaxed enough, when you hear your baby cry, these cause reflexes into your brain and the letdown reflex is released and the breast starts lactating well enough. You take good amount of liquids, breast itself is a sweat gland. You have a tendency to sweat more, the lactational glands function much more. Sleep well, eat healthy food, that itself should increase the milk secretion for you. And more amount of demand feeding as the baby cries, then you'll find that it is supposed to be a satisfied feed.
Thank you so much, ma'am, for your time and patience to answer all the queries. We have a question from one of our patients. Says, hi doctor, I am in my 5th month of pregnancy. I still have nausea and can't eat well. Please suggest.
Nausea in pregnancy can become problematic if it causes something called as hyperemesis gravidarum. As we all know, the ketone bodies increase, the starvation causes more amount of ketone metabolites and can cause neurological deficits in the baby. So at this point of time, this is again one more reason to make your antenatal visits more appropriate as advised by your clinician so that a timely intervention can be made and appropriate interventions can be done, medical management can be done to avoid this kind of nausea. But many pregnant mothers do have nausea and vomiting even till they deliver. I think we've very often seen it in our labor rooms. We find them vomiting on one side before entering the OT also. Very often we think it could be stress, but it could be the hormones itself.
Thank you so much, ma'am. I hope we have answered all the queries and addressed the nuances of pregnancy and nutrition in pregnancy. Thank you so much.
Thank you, Alika. Thank you so
Thank
much.
you.